The Patient Protection and Affordable Care Act of 2010. The main purpose of the Patient Protection and Affordable Care Act, PACA, of 2010 was to provide and expand the provision of Medicaid and Medicare to all persons who earn less than 133% of the standards established by the federal poverty level. The PACA 2010 was also created to provide subsidies to the uninsured, low-income population of America. These are the people who are not covered by their employer's health care insurance. The PACA was meant to empower low-income households to purchase health insurance covers from the newly established exchanges. People without medical coverage can purchase insurance coverage from the state-based insurance exchange, or they can be eligible within the expanded Medicaid and Medicare guidelines. People with health insurance coverage tend to use health facilities more than those without insurance coverage. Different research has been conducted about the aspect of insurance coverage for the American people. However, the findings of these studies are closely related. Research that reviewed the relationship between medical insurance and the utilization of healthcare by adults and children was done. The study revealed that individuals with medical coverage had a high probability of obtaining any healthcare service. In addition, a large proportion of people with insurance coverage made frequent visits to health facilities. The PACA intends to make health insurance accessible to everyone to promote the citizens' access to medical services. The PACA law requires all insurance companies to register and cover applicants irrespective of their medical conditions. Insurance companies are also required to charge their clients the same amount of premium irrespective of their geographical location and age. The law also stipulates that all individuals who are not insured by their employer, public insurance programs, or Medicaid and Medicare should purchase and adhere to the state-sanctioned private insurance or pay penalties and legal prosecution. The law expands the eligibility for Medicaid and Medicare coverage to include all individuals earning an income of less than 133% in reference to the designated federal poverty level. Small businesses are entitled to tax cuts if they purchase health insurance covers from the state-approved exchange. The law intends to set minimum requirements for health insurance coverage, and annual and life policies will be abolished. The New York Times has described the law as the most expansive law to be enacted in decades. According to the paper, the law enshrines the fundamental principle that every American should have primary security in health care. The creation of the PACA was a big step in ensuring that Americans access reliable and quality medical facilities and services. For a long time, many American citizens have been denied access to medical services by their insurers based on previous medical conditions that they fail to disclose. Insurance companies are established to make profits, as opposed to providing quality medical care to clientele. The requirement to provide coverage for all individuals irrespective of their medical conditions is a major step in reforming the United States health sector. The Act expands the coverage of Medicare and Medicaid to individuals and families that earn less than 133%. In addition, there are subsidies offered to the uninsured to purchase health coverage. These measures ensure that many people have access to quality and reliable medical care. The Act requires insurance companies to provide coverage to citizens irrespective of their medical conditions. This ensures that Americans are not denied access to essential medical services.